Okay.
Welcome. This is an overview of Better Health Through Housing by Better Health Together. The Better Health Through Housing project is actually, I'm getting a lot of, oh, okay.
Sorry.
Oh, you're fine. That echo is a little.
Yeah, there.
No. Okay, so now we're good?
Mm-hmm.
Okay. This is an overview of Better Health Through Housing with Better Health Together. My name is Sharice Pope, and I'm the Director of Clinical Integration for Better Health Together. And this is an overview of our Better Health Through Housing pilot project. The Better Health Through Housing is actually a contract that we won with the Department of Commerce. And this project has not been done within the state of Washington before. So we're very excited to have this opportunity. And it is modeled after a program in Chicago originally that has had pretty significant outcomes for their homeless population. We propose to serve around 50 individuals during the pilot period, and we are working with multiple partners, which we will show you in just a second, in order to do this 2-year pilot project that really benefits a single cohort of individuals, but our aim, again, is to take our lessons learned and make sure that this could be applicable across the state. So our approach was to unite partners across healthcare and housing, which has not been done before, and our objectives are to demonstrate to the extent to which the proposed program modifies and replicates a pilot in Spokane that will improve physical and behavioral health outcomes for individuals who are chronically homeless and high utilizers of ED services, improve housing retention and access to supportive services for participants, significantly reduce avoidable emergency department utilization and therefore healthcare costs, and to produce a reinvestment fund to sustain the project activities beyond the pilot project performance period. And that was a key piece of the Chicago model. So our partners, our hospital partners specifically, are Providence, the Downtown Emergency Department, and Multicare, which will be utilizing their Valley Emergency Department. Spokane Housing Authority, which will be administering our short-term rental assistance, and they will be working hand in hand with Spokane Neighborhood Action Partners. And then SNAP, Spokane Neighborhood Action Partners, and they will employ a community health worker as well as a housing specialist that will wrap around these individuals and support them through the housing process. And then we have our 3 managed care organizations here in our region, Spokane, Molina, AmeriGroup, and Community Health Plan of Washington. And their care coordinators will work hand in hand with SNAP's community health worker and housing specialists to meet any needs that these individuals identify as they go through the process to better support outcomes and well-being for these individuals. We have 2 components to this project. One is a panel, and the panel is really the individuals who are the boots on the ground, the individuals who will be interacting with the folks that we identify for this project, and we'll be making any adjustments that we need to the processes and the project itself as we go forward. The second component of this is the executive leadership team, and that team is really focused on a cost avoidance and reinvestment strategy. And they are working for the sustainability of this program. Our target population fall under 4 components: chronically homeless, individuals who have utilized the emergency department 4 or more times during a 12-month period, have a substance use disorder, mental health disorder, or a combination of these with a chronic medical condition, and then have a locus score of between 14 and 19. We expect that the panel, as we go through this process and this pilot project, that the panel may want to have some flexibility in tweaking kind of some of these requirements. For instance, in the Chicago model, they actually have the criteria that the individual has to have gone into the emergency department 8 or more times during the 12-year period. So there might be some flexibility as we go forward, but that target population is the criteria of which we are starting with. So for the panel, who are, again, the folks with the boots on the ground who are interacting with individuals who may benefit from this program, the panel has worked over the last several months of getting this project up and going to establish standard criteria for participant eligibility. And then as we go forward, they will monitor enrollment based on these criteria and coordinate care once a participant is enrolled. On our website, which will be Better Health Together, Better Health Through Housing, we will have all of the trainings that we are having and putting on, including this overview, as well as a locus training to go through the scoring criteria, as well as for the SNAP and the participant log. All those will be on our website, as well as contact information for the various entities, any announcements that we may have, and any of our forms will also be on the website, including the emergency department screening tool and the roles and responsibilities and processes. Here is our ED screening form, and so this is for our social workers within Providence and Multicare. Once an individual has come to you or been identified to you that they may benefit from this program, or if you're working with them and you're just in your head you think that this person might benefit, this is the form from which to work off of. As you see towards the middle, you're going to see, has the person been in the emergency department 4 or more times, yes or no? If it's yes, then you kind of work your way through down the rest of the criteria. Are they chronically homeless, yes or no? And we have included the definition, the HUD definition of chronically homeless for you. If that's a yes, then you go on to, does the individual have a substance use disorder, mental health, or chronic medical condition? If that's yes, then they have met the first 3 criteria, and at that time, then you get to administer the locus. And we will include in our forms the locus scoring tool for you to have. But if the individual scores between a 14 and a 19 on that locus scoring tool, then that person has met all 4 criteria, and you will be able to make a referral to the community health worker at Spokane Neighborhood Action Partners. So here's an outline of the steps from beginning to end through this program, and it also identifies who will be working on these. So our first point of entry or engagement is in the emergency department with a social worker. Again, this is a little bit of a repeat, but you are identifying individuals who may benefit from this program. You have gone through your screening tool, so the person meets the 4 criteria, and then at that time, you are to notify the community health worker at SNAP. From there, SNAP, once they have been identified by the social worker in the emergency department, will try their best to engage that person while they're either with you or get information so that they can contact that individual once they have left the emergency department, and will engage with them until the participant says that they are no longer willing or wanting to engage. The managed care organizations, if they have individuals who they feel would benefit from this program, may flag the emergency department as a heads up if they have an individual that might benefit and they know are accessing the emergency department multiple times. Then from that point is really the connection to housing. So the emergency department has completed all their pre-screening process and has connected the person to the community health worker. The community health worker receives the referral from the emergency department social worker. They meet with that individual either at the emergency department or another location. They get the contact information from the individual, and then they are responsible for starting the data entry on the participant log for our research and development purposes. They conduct a community health worker assessment to determine any other needs, and they consult with the individual to discuss options on where they want to go and how they want to process going forward. If applicable, the community health worker contacts Bridge Housing to reserve a Bridge Housing bed by 6 p.m. that evening, and they also contact the managed care organization that that individual might be connected with. The SNAP housing specialist works in conjunction with the community health worker. They take over the bridge or have other housing options. They coordinate entry plus assessment to determine path to housing, or do the SPDAT, as some of you may refer to this process as, is responsible for any HMIS data entry and works with the Spokane Housing Authority on rental assistance, and then provides ongoing housing stability and support going through the process. Our final step is stable housing, and this is ultimately what we want each individual to be able to have and access, and this is our goal for all of the participants. The emergency department, they will monitor if a patient is readmitted to the emergency department and file a separate incident or form if the person is seen again and reconnects with the social worker. SNAP helps maintain appointments and helps with community engagement. Spokane Housing Authority will be issuing rental assistance and any vouchers that are needed. The SNAP housing specialist will work on housing stability with the participant, assist with connection to additional resources if needed, facilitates case conferencing, and continues working with Spokane Housing Authority for monthly rental assistance and path to a voucher. The managed care organizations help make sure health needs are accessible, coordinates with community health worker for any needs that the participants are identifying, follow up and continue to follow up post-housing, and can help support any social determinant of health needs that the person has identified as well. So those are our, that's a brief overview of the Better Health Through Housing pilot project. Identifies roles and responsibilities for each step and process along the way. And again, our Better Health Through Housing on our Better Health Together website will have all of these webinars and resources, forms as needed. And I want to make sure that we are clear that those forms, as we go through the pilot project and learn more about the participants and resources and gaps in our community, may change. So if you want the latest and greatest, please go to our website where we will always have the most updated forms for you to access. All of the forms will be in a PDF fillable version so that you can fill them out and then email and or fax or send, however, to your other participants and collaborators within this project. If you have any questions or concerns at any time, my contact information will also be on the website, and you can feel free to call or email at any time that you have questions. Thank you so much for participating in this pilot project. We are excited to serve this particular population, and we are excited to work together and really come up with a model that can be sustainable across the state of Washington. Thank you. 17 minutes. I think we did okay.